गुड मॉर्निंग टू ऑल। नमस्कार। आज हम त्रिविध परीक्षण का लास्ट पार्ट ले रहे हैं। अभी आप कह रहे होंगे कि सर हम अष्टांग हृदय के सूत्र स्थान का रीडिंग कर रहे हैं और एक एक सूत्र को इतना वक्त क्यों लग रहा है, मतलब इतना ज़्यादा एक्सप्लेनेशन फॉर ईच एंड एवरी सूत्र, ये इतना ज़रूरी है क्या? तो त्रिविध परीक्षण के बारे में अगर कहेंगे, यस, इट इज़ रियली रियली वेरी इम्पोर्टेंट. It is really very important to understand how the Trividha Parikshana is going, and if further also, if the sutra will tell about the like Ashtavidha Parikshana, then also that much of explanation, because these are the basic roots of Ayurveda. Without these, you cannot you cannot go further and learn properly. Okay, so when we talk about the prashna parikshana, this is the very important part of प्रश्न परीक्षणा मीन्स अभी जब भी हमारे पास कोई पेशेंट्स आते हैं तो इन जनरली what we actually what we actually see and what we actually ask to the patient, that is very big challenge to diagnose the patient on the basis of the questionnaire. The as per the diseases, we have we have make some questionnaire. Okay, but on exactly किस किस पार्ट के ऊपर हमें क्वेश्चन पूछना चाहिए, questionnaire is depending on what we called, see, I have made some questionnaire. So the questionnaire regarding the fasting, nidana, excessive walking, dry food intake, old age, okay, according to that you can ask. Lakshana of a pain, stiffness, tremors, numbness, restricted movement. If you're talking about the vata dosha, if you're talking about the vata dosha, ask the nature of pain. It is a moving pain or the shifting pain or the severity of the pain or pricking pain or dull pain. Okay, ask about the aggravation of the factors, pain worse in a cold or evening or in a movement or in a sitting or in a walking. The relief factors with oil massage or a warm fermentation or a cold fermentation. Modern clinical correlation where you can ask like a location of the pain, radiation of the pain, numbness, tingling, weakness of the limbs, history of the trauma. So location of the pain, most probably we can see through the darshan and sparshan parikshana where exactly the pain of the patient is happening. Okay, radiation of the pain in appendicitis and all cholithiasis, we can understand the pain is referring from one part to the another part. Numbness and tingling of the is actually in a compression of the nerves or in paralysis or stroke patient where we can see the numbness and power loss. Weakness in limbs also we can find in a power loss of the patient. Is there any history of a trauma or accidental injury? Due to that, any fracture is happening, that we have to ask. So possibility of these all are the stroke, cervical or lumbar spondylitis or compression, neuropathy, sciatica or arthritis. So what exactly we need to ask is ahar, vihar, dinacharya, okay, nidra, agni, Mala, Mutra, Artava, and what are the Sathmya part compatibility of the patients that we have to ask to the patient. Okay. Now, in practically, if suppose the Jwara patient is coming to you, okay, what are the few points that you must ask? Okay, one is the fever is continuous, intermittent, or periodic. Means you can understand the avastha of a Vishamajvara. When did the fever getting start? How did the fever getting start? Why is the fever getting start? What type of hetu patient has been taken? That you must know. If the patient feeling chilling, burning sensation, or chills, or rigors, or body ache, or urticaria, if the patient feeling dryness of mouth, excessive thirst, if there is a loss of appetite, if the fever is coming in every 2 hours, or in afternoon fever is very high, is there any headache, nausea, vomiting, pain in abdomen, loose motion, diarrhea? These are the type of the fevers you must ask, that you can understand why the fever is actually happening. It is from a viral fever from vata jvara. It is an infectious fever like a vat pitta jvara. It is a bacterial fever like a vat kapha jvara. It is a sannipathic fever like a vishama jvara. It is a agantu jvara like from the kitaluta dansha like a dengue, malaria. It is a manas jvara. So this type of hetu, and according to hetu, you should understand the types of the jvara. In Raktapitta, nowadays heat is very increasing in Pune. Okay, around 39 to 40 degrees Celsius temperature is happening in Pune. So the burning sensation of foot and soul, bleeding from the nose, mouth, stool, the color of the this type of happening nowadays. So sometimes patients still having the same diet that they have taken in January and February in a cold season in India. They are still continuing that type of diet, and they feeling fissure piles. They feeling fissure and piles. Okay, so and if the blood is coming continuously from per anal region, you need to understand the color of the blood. It is a completely reddish color blood, or it is completely reddish color blood, or it is completely brownish, or it is something red brownish color blood. That you have to see in the diagnosis of the per anal bleeding. Because when the blood is very fresh and reddish, it is coming from per anal, it is from the anal region or from the bleeding piles maybe. But when it is coming when it is a slightly brownish and blackish color, it might be coming from the intestinal part. So might be it is a intestinal bleeding or fibroidal bleeding. So you must go through with the endoscopy to understand which type of why the bleeding is continuously happening. Okay, and there should be a history. Means yesterday I have the patient which is very good in the BMI, very good in their diet, and still the patient having a pain in their sole, leg sole. Okay, so when they saying to me that they having a pain when they are sitting, and for a longer time when he sit at one position, and when he try to get up, he have a severe pain in the sole and burning sensation in the sole. So he's very diet conscious, he's very exercise conscious person, he's taking very good diet. But what exactly I found in his diet, that He's taking daily morning around 6:30, 5:30. He's taking fenugreek, मेथी के दाना का पानी, sometime जीरा पानी, sometime नींबू पानी, sometimes अजवाइन pani, sometime avla ras, sometime tulsi ras. So this type of juices he regularly been taking. So I'm not so much surprised by this type of YouTube tips, but I must say to every patient, you should go through with your body structure and understand your body structure. What is your prakriti, and according to your prakriti, you should take the diet, not from the tips from the YouTube. Okay, and he has always a habit of taking a continue coffee, black coffee. Okay, and he has a prakriti of a pitta. He's taking continuously black coffee. That triggers the heat in his body, and that's why he's having a burning sensation in a soul and this thing. So you must ask the patient that he's having any history of excessive sour food, hot food, spicy food. His bleeding is sudden or recurrent. So is he feeling weakness or dizziness? This type of question you must ask to them. Now regarding shwasa, if the patient is coming, so see the pattern of shwasa, how he is taking the breath, through by nose or through by mouth, that you have to go through it and see properly. So there are there are many pulmonary function tests also. There is a simple pft test also, by by doing the ball test, through which by air the ball is going upward, how much of pressure that air is putting on that ball, and that much you can understand that how is the ball is moving forward, and you will understand the capacity of the breathing. In the cases of COPD, you will get only one or two ball only get up by the pushing the air. Okay. So is there any difficulty in breathing? Is there any difficulty in breathing while sitting or while lie down? How is the chest shape is going, that you can see by the darshan parikshana. But uh, you must ask some sometimes there is a allergic asthmatic patient also we found, that come into vat pitta kapanubandhi patient, means the allergy is happening due to the vata pitta, and the increasing of secretion is due to the kapha dosha. That's why I'm saying allergic asthma, it is a vata pitta kafanubandhi tridoshatmak vyadhi. So is there any dust exposure or allergy that you have to find? Many times what happen in a cough, like in a penis cough, the patient have a habit of taking water intake at night also. Large amount of water intake at a night, that creating a penis and kapha dosha. Many time a patient having a habit of taking a milk at night, that is also increasing the kapha dosha in his body. So how the kasa is increasing? So you should differentiate the kas in two avastha. One is a vataja avastha and one is a kafaja avastha. One is a vata pitta avastha, one is a vata kapha avastha. Vata pitta avastha, it might be having the the dry cough, or sometimes vata avastha is having only a dry cough. Sometimes a pitta avastha, a patient having a cough with burning in chest, yellow sputum, and severe constant allergic cough is continuously happening in the case of vata pitta avastha. In the stages of vata kapha avastha, there is a productive cough, whitish cough, productive cough. Each time there is a balgam, there is a crippling sound, breathing sound. This is cases of what Kafaj avastha, bronchitis avastha, COPD avastha. In this case, you will find this type of cough. So by looking darshan parikshana also you can happen, but you have to ask the question that the patient having a habit of smoking, habit of working in a dust, or habit, or he has taken any dahi or ice cream or this type of, or late night food or late night drinking of water. So this type of question you have to ask in the kafaj vikara. Let's see let's see in a rajeshma patient, the cough might be persistent for 3 to 4 weeks, like a dry cough, persistent from 3 to 4 weeks, suddenly weight loss, sudden weight loss around 5 to 6 kg, and continue coughing. Okay, is there any swelling all over the body or any lymphatic swelling, lymphatic gland swelling, like inguinal or tonsillar or mandibular or axillary, any swelling in the body, that you have to see to understand. Is there any evening daily fever, mild evening fever? Okay, a mild evening fever, swelling on lymphatic glands, persistent 3 to 4 weeks cough, sudden weight loss is the some questionnaire you have to ask in rajeshma, and that you can diagnose is by relative investigations also. In Atisara, most probably in local GP patient, you find that the patient, now most of the poor patient who are worker, they mostly taking non-veg on Saturday and Sunday, and they get affected and come to your clinic on Monday with the atisar, pain in abdomen and fever, because they not cook the food very properly, and because of uncooked food they got this type of, and yes, they taking the alcohol along with this food, so that increase the uncooked and infectious food to eat to them and happening with the atisara. So you must have to understand this type of, so the peristaltic movement by darshana and sparshana movement, peristaltic movement is increases. So in atisara you have to ask the hetu, what you have been eating or eaten, and when does it happen, why does it happen. Okay, and how the stool is coming, stool is with a very smelly false smell or watery or very sticky like a pravahika. So you will understand it is in a samaj avastha or niramaj avastha. If it in a samaj avastha, you don't have to be very much hurry to stop the atisar. Let the infection come out, let it go. Till the infection is coming out, the patient didn't feeling the weakness. As the all samavastha is removed, the patient start feeling weakness. So you need to understand the samavastha and niramavastha in cases of atisara by asking the question of the swarupa of the stool, or you can see the patient's stool formation. Okay, there again an infection part and viral part also is there. In viral dysentery, there is only watery dysentery that may be comes under the Vata Pitta Atisara, and there is a when is that there is an infectious dysentery, it come into the Vata Kapha Atisara. Okay, Vata Kapha Atisara might be in a Sama Avastha, go to the Pravahika, then Grahani, then Agnimandya. This type of Hetu and Samprapti might become. So you have to be understand in Kafaj Avastha, it might be go to the Kafaj Grahani, Kafaj Pravahika, and Kafaj Atisara. But what exactly happen if you talk about the, Grahani? Many patients have the Grahani, various types of Grahani. The patients feel the Grahani part. So why the grahani is actually happening, it is because of the irregular timing of food. You should ask. The patient always say one classical symptom, that whenever he eat, he has to go to the passing a stool. So in a day he go to pass the stool for 3 to 4 times. In the morning 2 times, in afternoon one time, in evening one time, and sometimes at night also. So this is not a good habit of going for 3 to 4 times to stool in a grahani avastha. So how the grahani is happening? The patient have a habit of eating coffee, tea in the morning and go to the stool passing. That is also happening. So because of ushna, tikshna, daha, ahara, the patient having a habit of going passing the stool, and sometime in a chronic anxiety stage of mind, patient also having a grahani, consciousness, increased consciousness, anxiety, fear. In that case, also sudden onset of passing of loose motion, that also happen, that you have to be see during the cases of grahani. So you have to see the abdomen. Is it in a vata javastha by sight of a pain in a grahani, or is it in a pitta avastha having a burning sensation, or is it in a kapha avastha, a distension of a abdomen? Whenever he having a food, a slightly little food, his abdomen getting distended. Okay, he said he unable to pass the gases properly. So these and many type of symptoms happen in a grahani. So you have to see in the all these symptoms in the grahani by asking the questionnaire. So in the case of kushta, actually we can see kushta by darshan parikshana only. At what exactly places the kushta is happening? Is it in a axillary part, or is in a groin area, or is in an abdominal area, or is in a hand, leg, back, head, back of the neck, back of the ear? So these are the main points where the patient having a most of the sclerotic and the skin lesions has happened, and that might be a reddish or blackish or whitish. So according to their color, we can differentiate it is a vataj, pittaj, kaphaj. According to the kanduta, according to the dahata, you can differentiate into the dosha of that types of the kushta. Okay. In case of udara also, most probably nowadays you are very easily to to find out the udara. But I always say udara is coming from the Agni Mandya. You have to go to the history. Why there is Agni Mandya? Why there is a happening of udara? So find out the hetu. Ask the patient about the hetu. Is it having a habit of taking a continuous alcohol? Is it having a habit of taking the alcohol which is a local and very poor in a quality? So it doesn't mean that taking good alcohol is good for health. No, alcohol can be taken occasionally and monthly once, but daily basis taking alcohol is bombarding to the digestion and the agni, that leads to the agni mandya leads to the rakta dhatu and mansa dhatu dushti, which is actually the basics of yakruta is made of rakta and mansa dhatu, and because of that rakta and mansa dhatu dushti, first agni mandya leads to grahani, then grahani leads to the yakruta dushti, then yakruta dushti leads to the pitta avastha, that is paka avastha, and then there is the yakrut necrosis is starting. And there might be other diseases also in the like hepatitis B, hepatitis A, hepatitis C. In that case also there is a viral infection through blood infusion or through water, infected water uh, intake. Also there is a hepatic changes is occurs, bilirubin level increases, and sgpt level go to 2000 to 4000. So in that case also the agnimandya is happened due to the agantuch hetu, and this agantuch hetu leads to hepatitis, and that leads to udara. Vatvyadi we have already discussed, but when we're talking about the manas vikara, when we're talking about the manas vikara like a unmad and apasmar, We have to go through. These are the some type of disease like they are genetical. Okay, from birth, some people, some baby having that this type of lakshana. So patient might having uh, a rhythm or pattern of unmad episodes. Patient last the episode till 1 to 5 minutes. Patient having this episode continuously in a day, or the behavior changes, or the confusion state of a mind, or the mind with the samshaya, bhaya, palpitation. These are the state of mind with mood swings. Sometimes he's very happy, sometimes he's getting very angry. So behavior changes. Irrelevant talks sometimes getting very much silent. So these are the changes of behavior of the Unmada patient. We have to see and go through it with asking the questioner to the patient according to his behavior and the hetu, and ask the trigger points why it actually is happened. So it's not happening in a one session. You have to take the counseling of questionnaire in 1 to 2 session or 3 session, and then you will get understand what exactly triggers the patient in unmada avastha. So in unmada avastha the questionnaire is very very important. As same in apasmara avastha also, the sudden loss of consciousness when he fell down, how he fell down, if he has a convulsion, if he or she has the convulsion like a fatigue or mass tonic or atonic. Okay, or it is like in a vataj avastha the eyelids go upward, very strong convulsions episodes come. In pitta avastha eyes become very reddish, he become very aggressive, he's scolding, he's yelling. In kapha avastha, the frothing, something secretion coming from the mouth, his eyes become complete white, his tongue become dry, whitish coated, his body become cold. So this type of stages of convulsions happens in apasmara avastha. You have to go through the with doshik avastha. And after the completion of the episode, patient doesn't understand or doesn't know anything what happened, but patient feel that something has happened to me. Patient feels sudden weakness in the body. In vata avastha patient feel completely body pain. In pitta avastha patient feel a very burning in maturation, and his soul and hand become very burned. In kapha avastha patient feel very stiff, very lazy, try to sleep in a whole day. So these are the symptoms found in apasmara avastha, and vatrakta avastha is very typical. I have already told in before Vatvedi also that whenever any Vatvedi patient asks, the four question is where pain, shoth, mobility, and accessibility. Pain, shoth, mobility, and acceptability, वो उसका हर एक जगह पे on which part the pain is happening. Like in vatrakta it start from the toe, it start from the toe and bone. After a few days or month, bone in uttan vatrakta when transfer into the gambhir, the bone become deviated, and that's will restrict the joint movement. So friend, overall, we can understand that we have to ask Ahar, Vihar, Agni, Nidra, Mala, and previous any history you have to ask. So then, how you can? So in the case of case taking, these are the points you have to understand while taking a case of according to disease. But when we're talking about the taking cases, the patient come. to your clinic, see the gait of the patient, how he's walking, how is the gait, how he's talking, how he's sitting. You have to very careful of it. When he sit down, how he's sitting. It is a comfortably sit, the uncomfortability seen on his face. Then take the patient to the table, examine overall the patient from head to the toe. Okay, ask the question what exactly happening. He will say to the answers. He will say to the chief complaints, and always ask the chief complaint on his language, which he is comfortable. If he's in Marathi, if in English, Hindi, Tamil, Malayalam, Hindi, Gujarati, whatever the language, he is very easy to talk. On that layman language, we should ask and take the answers from the patients, what exactly is happening. Then take the blood pressure, see the chest by stethoscope, fold the knees, see the abdomen, see the palpitation. Is there any pain you found? See the legs, any swelling, pitting edema, and see the chest examination properly. How the chest examination will be. The right fourth intercostal space, then the left fourth intercostal space, then the mid axillary line. At the fifth intercostal space, we can see the heart sound, and then the cardiophrenic angle, where also we can see the heart sound, and then the right costophrenic angle in the mid axillary line. So one, two, three, four, five. These are the 5 points of auxiliary examination point through the stethoscope, and say if the female is there, you can take this examination from the back side of the back side. Okay, and male you can see on the front side. Okay, so always see the any, if you see some patient having a coughing or something like that, you can see the by torch, by tongue examination, glottis examination. Okay, if the ear problem is there or ear is paining through the cough, try to pull the pinna. If the if by pulling the pinna, if he having the pain, there's externally or externally mastitis or external auditory canal infection. By pulling the upward, then there is a inner internal ear infection is might be there. So after looking the patient, take the patient to the table in front of you, see the nadi. See the nadi very calm and composed. See the doshik nadi, what is going on, flowing on the superficial level. And then see the deep nadi. You will understand the prakruti. By understanding prakruti, by understanding the flowing dosha according to biological clock, what's going on time. According to that, the flowing dosha must be flow. And then write it down. And then ask the question according to dhatu. Rasadhatu, are you feeling hungry properly? Show your tongue, see the tongue, see the samata, niramata. Ask the another question for Rasadhatu in female. Is there proper artava, proper menstrual cycle? Okay. How is your appetite? Okay. In a Rasadhatu. See the skin for Rasadhatu, dryness, fungal, or hair loss in a Rasadhatu. In a Rasadhatu, you should also ask for the history of hypothyroidism, diabetes, PCOD. Is there any history? You have to ask. Second, Rakta Dhatu. Is there any itching on the body? Is there any discoloration on the body? Is there any kushta on the body? Third, Mamsa Dhatu. Is there any shul in a muscle like a pindiko doshtana vedana in a muscle? Is there any muscular infection, muscular dystrophy, muscular atrophy, muscular cyst, muscular fibroid, or muscular pain? Meda Dhatu, ask the question about the urine. At night, in how many time you get up for urine? Ask the history of diabetes or prostatitis. You have to ask. If the urine is coming in a early morning, 4 p.m., 4 a.m., 5 a.m., in early morning making disturb his sleep, that is because of sugar. If the urine is coming after the sleep 2 to 3 hours in a midnight, 2 a.m., 3 a.m., prostatitis. That is a kala of in that kala that is happening. Okay, because kafakala, on kafakala patient try to get up, in vatakala in prostatitis, and pittakala patient try to get up in prostatitis. Okay, medadhatu, how many time he get up, so the infection of medadhatu is seen in the urinary questionnaire. Asti dhatu, see where the pain is happening. Is there any shoth? Is there any crackling sound? Shabda sahishnutta, Shabda gamitvam in Sandhi. Sandhi Shabda gamitvam is there having while sitting, while walking. Is there any pain in the joints? Asti dhatu. You can find out Samavastha by swelling. You can find out the Niramavastha or Shayavastha by crackling sound. Majja, is there any tingling and numbness? Is the patient having a history of fainting? Is the patient's eyelid drops many times, rasashaya or pittaruddhi? Is the patient having a habit of eating a pittaruddhikar ahar? So the pittaruddhikar ahar also affected the majja dhatu, because majja dharakala and pitta dharakala is ashraya ashra sambandha. Shukra dhatu, ask the question about the children. Ask the question, if the patient say no, then further questions for shukra dhatu and the marriage and the um, erectile dysfunction or premature ejaculation for male. And for female also you can ask the question about the shukra dhatu. Is there regular menses is coming or not? If yes, then okay. If no, the how the menses is coming, how the swarup of the menses, and is there any follicular study is done or not. So then again the hormonal changes and hormonal investigation you have to do. Okay, and then you can ask the question about the tridosha. For tridosha pranavayu, is there any breathing problem? Samanvayu, is there any flatulence, abdominal distension? Is there any gaseous problem? Do you feel hungriness on time? So this type of question you may ask. Okay, so in a pranavayu, then udanvayu, is there any difficulty in talking? Is there any difficulty in breathing? Is there having a hiccup or continue hiccup or sometimes of hiccup problem? In Vyanvayu, there is a palpitation. In Apanvayu, there is a proper motion is happening or not, proper urine, proper mutra, proper sweda, proper artava. You have to ask. So five types for pranvayu questionnaire we have to ask. Then go for pitta, ask for pachak pitta. How do you have a proper time of hungry? Do you eat food properly? Do you digest the food properly? Means after eating the food after 3 hours, do you feel the jirna lakshana? You must know the jirna lakshana. After 2 hours, you will find the uh, thirst. After 3 hours, you will find the malamutra, vega, laghavatva. So these are the jirna lakshana you should ask to the patient. By means you will understand how is the pachak pitta and how is the agni of the patient. Again, to understand the pachak pitta, you should ask the abhyavarana shakti. At one time, patient how much food intake, how much the capacity of the patient he will take at a one time of eating food, that is also comes under the pachak pitta. Then come for a kapha dosha, go for a kledak kapha. Kledak kapha, see any swelling all over body, see the swelling on particular part, on a face, on eyes, on a joints, on a leg, on ankle. Is there any swelling? By just looking the shotha, you will understand the kapha dosha. Then see for mala, nidra, mana. Mana, you have to ask the psychological symptoms which we have asked in Unmad and Apasmar. By this understanding the case taking question, write it down which dosha, dhatu, mala, disturbance you found in asking questions. So write it down. Yeah, vata dushti, prana dushti, samana dushti, apana dushti, pitta pachak dushti, kafak ledak dushti, dhatu, brasa, mansa, meda dushti, mala, this dushti. And according to that, ask the again question to ask any other question or any history, ask to the patient and then write it down and then give pachana of that dhatu mala, pachana, pachana treatment. Okay, according to that dhatu. Because when you're doing dosha paka, when we're doing dosha paka, disease is curing. When dosha comes to the dhatu and dhatu paka, then it is a roga avastha. Don't make a hurry to make your diagnosis. Okay, just see the symptoms and treat the symptoms, and then according make your diagnosis a provisional diagnosis that can be is there. And by giving by giving the medicine, if the patient feeling better, then you can go with your proper diagnosis. So friends, these are the question you should ask in case taking according to the dosha, dhatu, mala, and srotasa also, and srotasa also, annava, srotasa, pranava. But these are come into the dhatu that included. So Miss Halama is asking the question, always climbing stair feels pain. Some say downstairs get pain, flow some light also. Why nowadays knee pain and katigraha? Why please flow some light on this? In that avastha, you should see the nadi. Many times in vata avastha, patient always in a confused state of mind. They are always in a confused state and they are confusing us also. But nadi never confuse us. See the nadi, see dosha avastha. It is a kapha avastha, then it is a graha. It is a pitta avastha, then it is a shaya. If patient having a severe pain and pitta nadi and vata nadi, is a degenerative changes and shaya avastha. If it in a severe pain, inability to moving, unable to bend the knees, it is a kapha avastha, ama avastha, and it might be a amavata. So you have to go through with it by nadi. Kanduta in ski, how you differentiate pitta involvement rather than kandu. Yeah, whenever there is a pitta, there is a reddish lesion on the body. Whenever there is a pitta, there will be a reddish lesion on the body, and that reddish lesions on the body, like in a eczematic, reddish eczematic, and like a psoriatic patient in a prathamik avastha, complete reddish avastha. And when the psoriatic, like a vatarakta is always in a psoriatic arthritis. I always why people correlate Vatarakta with gout? Always I have a question. But I always feel that Vatarakta is always correlating with the skin diseases. Having a reddish patches and Kanduta. Because of Dahata, patient feeling itching like urticaria also you having a very Pitta Ruddhi. And because of that Pitta Ruddhi patient having that urticaria and that Kanduta. Okay friends. So I tried to complete this Trividha parikshana with very longer session. I'm sorry for that. But it's absolutely very needed to explain the Trividha parikshana in this way. By means your basics of your case taking will go with properly. Okay. So next will be we will take Okay, Dr. Savita. In the next case, they have given the one shloka Abhishek Dravyanupastata Rogi Pada Chatushtayam. They have given the qualities of Rogi, qualities of Vaidya, qualities of Bhishaka, qualities of Dravya. Okay, so that we will continue with some classical patients example that why this four Chatushpath is very important. By understanding this four Chatushpada, you must know which patient to take and which patient to not. If the patient is not in that quality, don't try act smart. Just leave it. If the patient is very smart, not listening to you. Okay? So thank you for today's session. We will meet tomorrow. Jai Mahakal.